A dental implant is nothing more than a man-made root. It's a small titanium post. Basically looks like a screw that would use to hang something on the wall. The only difference is that when a tooth is lost, this implant is going to go down into the jaw to replace the roots of the teeth. Whether the tooth is there to begin with, we take it out that same day, or whether the tooth has been lost for a while. Same procedure, we place the implant down in the jaw. Once that integrates with the bone, which takes about 4 months, we can put something on top of it called an abutment. The use of the abutment can then, we can put a crown on top of the abutment, we can attach a denture to this. It has a number of different functions. So same idea as far as using this as a fixture for a wall. Once you put a screw in or a bolt into a piece of wood that you can hang something on, whether it's a mirror, a piece of art, coat rack, whatever. Same idea as far as with the dental implant. We're gonna place this down into your jaw. It seems like it's a more complicated process, but it's relatively simple. The technology has been around for decades now. As long as the patient has good quality bone, good soft tissue, good oral hygiene, this implant can last for decades. A bridge is a prosthetic of 3 or more crowns that are all one piece. So you would have multiple healthy teeth or teeth that need crowns, spaces in between them where you're missing teeth. You use the teeth on the ends to hold that bridge, and then there's fake teeth all connected in the middle. So it's a one-piece unit that is then cemented onto teeth. 9 times out of 10, the implant is going to be a better solution long-term than the bridge. There probably are some indications. You can't always say always or never. The advantage of doing an implant is that it's going to help retain bone where that tooth is missing, where a bridge is not. The other advantage is that it's going to be more cleansable as far as cleaning the adjacent teeth and keeping those healthy as well as the implant. Whereas the bridge, you can't floss, you'd have to get underneath it, it can trap more food. So long-term, hands down, an implant is a better solution in a vast majority of the cases. That question comes up all the time, are implants expensive? It really depends, and it's very difficult to answer that question. Are they expensive compared to a root canal, a buildup, and a crown? Are they expensive to no treatment? Are they expensive to just doing dentures without implants? It also depends on potentially what kind of insurance the patient has. So there's a whole bunch of things that go into that, and so that's why when patients call and they say, hey, how much is a dental implant? There's so much more that goes into it, whether we're talking about, has the tooth been lost for years and we potentially need to do some bone grafting and build the foundation better for that implant? Do we need to do any sort of soft tissue management? So when patients call in and they're looking for some sort of hard number, I would just invite them to come in. We can sit down and talk about it and say, hey, let's look at your case and go from there. And then we can figure out whether or not you think they're expensive or if you think they're a good value.